Hey guys, Dr. Mike here for your health. Have you ever heard of a deep vein thrombosis? Maybe you have, but you're not really sure what it is or what it means for you. Well, that's what we're talking about today. We're going to do a deep dive into DVT, covering everything from its causes and risk factors to treatment and prevention. Now, DVT might sound like something that only affects older people, but the truth is it can happen to anyone. So whether you're just looking to learn more about DVT or you're concerned about your own risk factors, this video is for you. Stay tuned and let's get started. So what exactly causes deep vein thrombosis? Well, it all starts with your blood flow. When blood isn't flowing properly, it tends to pool, leading to the formation of blood clots in the deep veins of your legs. Immobility is a common culprit. Think about those long flights or sitting at your desk for hours. Surgery, especially involving your legs, hips or abdomen, can also increase your risk. Certain illnesses, like heart failure or inflammatory bowel disease, can make your blood more prone to clotting. Some medications, like hormone therapy or birth control pills, can also increase your risk. Understanding these factors can help you take steps to reduce your risk. Let's move on to see if you might be susceptible to DVT. Now that we've covered some of the common causes of DVT, let's talk about risk factors. Age is a big one. As we get older, our blood naturally becomes more prone to clotting. Genetics also play a role. If you have a family history of DVT or blood clotting disorders, you're at an increased risk. Lifestyle choices can significantly impact your risk. Smoking damages your blood vessels and makes your blood thicker. Obesity puts extra pressure on your veins and slows down circulation. Even if you're young, these factors can still affect you. Being aware of these risk factors can help you make informed decisions about your health. Now, let's talk about what happens if you do develop a DVT. Early detection and treatment are crucial. Let's dive into the treatment options available. So what happens if you do develop a DVT? The good news is that there are effective treatments available. The primary goal of treatment is to prevent the clot from growing larger and to reduce your risk of complications. One of the most common treatments for DVT is anticoagulant medication, also known as blood thinners. These medications work by interfering with your blood's ability to clot, making it less likely for existing clots to grow and for new ones to form. In some cases, your doctor might recommend thrombolytics, also known as clot busters, for more serious cases. For some individuals, surgical interventions might be necessary, such as a thrombectomy, to remove the clot. Treatment for DVT is highly individualized, considering your overall health, the location and size of the clot, and your risk of complications. Your doctor will determine the most appropriate course of action for you. Now let's shift gears and talk about prevention. Prevention is always better than cure. The good news is that there are steps you can take to significantly reduce your risk of developing DVT. Stay active and avoid prolonged periods of immobility. If you have a job that requires you to sit for long hours, make sure to get up and move around every hour or so. Maintaining a healthy weight is also crucial. Losing even a small amount of weight can make a big difference in your DVT risk. Compression stockings are another great preventative measure, especially if you're at an increased risk of DVT. These stockings work by applying gentle pressure to your legs, which helps to improve blood flow and prevent clots from forming. By incorporating these lifestyle changes and following your doctor's recommendations, you can significantly reduce your risk of developing DVT. Remember, prevention is always better than cure. Now let's understand the potential complications of DVT. While DVT itself is a serious condition, it's essential to understand the potential complications that can arise if it's left untreated. One of the most serious complications is a pulmonary embolism, or PE, which occurs when a piece of the blood clot in your leg breaks off and travels to your lungs. This can block blood flow to your lungs, leading to shortness of breath, chest pain, and even death in severe cases. Another potential complication is post-thrombotic syndrome, or PTS, which causes long-term damage to the valves in your veins. In rare cases, DVT can also lead to complications like venous gangrene, which occurs when the blood supply to a limb is completely cut off. Prompt diagnosis and treatment of DVT can prevent these serious complications. That was a lot of information, but it's important stuff, right? We covered the causes of DVT, the risk factors, the treatments, and even what can happen if it's left untreated. Remember, knowledge is power. The more you know about DVT, the better equipped you'll be to protect yourself and your loved ones. If you found this video helpful, give it a thumbs up and subscribe to our channel for more evidence-based health information. And as always, this video is not intended to be a substitute for professional medical advice. If you have concerns about your health or think you might be experiencing symptoms of DVT, please don't hesitate to reach out to your doctor. Stay healthy and take care.